So let's watch The Pitt Season 2, Episode 9 together. As far as medical dramas, it's actually pretty well done. There was a lot of OBGYN content in the first season, and I've been waiting for them to do a GYN case.
No, I've had years of pain after switching to a gyno who actually listened to me.
Common story.
Take time to make the diagnosis. Sounds like an excuse for lazy doctoring.
A little bit.
It doesn't help that some of you don't listen to women, let alone brown ones.
Also true.
Vaginal ultrasound before. I've lost count of how many times.
Also very common. Anytime you go to the ER, you're going to get one. She knows what to do. She knows the position.
There's one big one about 5 centimeters.
Doesn't look 5 centimeters.
Checking blood flow to the ovary.
This is going to be a torsion. They're looking at blood flow.
Some morphine to take the edge off.
Looks like a torsion. You can usually tell from the door if somebody has a torsion or not. So this episode touched base on several really important issues in women's health. The first is patient dismissal regarding pelvic pain, especially individuals of color, which I thought was really thoughtful casting. Research actually demonstrates significant racial disparities in the dismissal and undertreatment of pelvic pain. The second is the pregnancy test. This is one of the first tests we do in the workup of any pelvic pain or abnormal bleeding in a reproductive age person. And this is because this takes us down an entirely different diagnostic pathway if the pregnancy test is positive. And especially in an emergency department setting, we don't want to miss something life-threatening like an ectopic pregnancy. We actually find surprise pregnancies all the time, even in the setting of a history of infertility and someone needing IVF. However, it's very important to recognize a pregnancy test may be triggering for a patient with infertility. The third is ovarian torsion. This is a surgical emergency when the ovary twists on its own blood supply. Typically, a cyst is present when this occurs, and it causes acute onset severe pain. There can actually be intermittent torsion. They really highlighted the use of transvaginal ultrasound in this episode. Ultrasound can sometimes show decreased or absent blood flow to the ovary. It can diagnose a cyst, but normal blood flow does not rule out a torsion. If I am suspicious enough a torsion is happening, I would recommend a laparoscopy. Overall, I thought the episode did a thoughtful job highlighting pelvic pain, diagnostic uncertainty, and the importance of listening to patients. Have you been watching The Pitt? Let me know your favorite scenes in the comments.